Good afternoon, and welcome to today's session on COVID-19 and mental health for older adults. This session is being jointly offered by Rutgers Institute for Health, Healthcare Policy and Aging Research, along with Rutgers Graduate School for Applied and Professional Psychology, along with our community partners, New Brunswick Tomorrow, the Center for Asian Health, Robert Wood Johnson Community Health Programs, and the Trenton Health Team. As indicated on the registration form, the lecture portion of our lecture today is being recorded for individuals unable to attend. Please, at this time, mute your microphones. There will be an opportunity at the end of the lecture for question and answer. You are welcome to type in any questions that you have in the chat box. It will be monitored throughout the session by our presenters. And at this time, I would like to introduce today's presenter, Arata Yunusova. Thank you. And it's all yours.
Thank you, Dan, for that warm introduction. Hello, everyone. It's nice to see you all attending and joining us today. I'm just going to share my screen so you can all follow along as we present. Okay, perfect. Okay, so like I mentioned, hello everyone, and it's really nice to see you all today. I can see there's a lot of different families here and individuals joining us. As Dan mentioned, I'm one of our community partners. We're working together, and I'm a team leader through the New Jersey Hope and Healing Crisis Counseling Program. We also have a few other team leaders and crisis counselors joining us here today. So the past year has brought many unexpected challenges into our lives that have been difficult to navigate. And so therefore, with funding through a federal grant, we're able to provide various services to support you and your communities for a limited period of time. In addition to our webinars, such as our webinar today and our group services, we also offer some individual services, which I'll be able to touch base on at the end. Just in terms of the structure for today, for the first 20 minutes or so, I will present some helpful information regarding our topic, and then we'll open up our remaining time for your thoughts and your questions. Please feel free to stay on the whole time or to leave the meeting when you need to. The first portion of the meeting with the presentation will be recorded, as Dan mentioned, and so that we can distribute this information with others. So the question and answer portion will not be recorded. During the presentation section, I may pose some questions to facilitate some reflection, but we will not be calling on participants for responses because of the fact that we'll be recording the first portion. Please feel free to think on these questions privately or to discuss them with the individual sitting beside you. Once we open up for question and answer, we will stop the recording and we'll be inviting audience members to participate utilizing video in the chat box below. Okay, so today and over the course of the next 4 weeks, we'll be able to meet for a total of 5 one-hour weekly webinars to expand our understanding of the stressors many of us have been facing and to discuss ways in which we can support ourselves and one another. So here's an overview of the topics we will discuss each week. You're welcome to attend all the meetings or just the ones that you're interested in or able to attend. So today we will explore common stressors and stress reactions we may be experiencing. We'll also consider ways to cope and some resources you can access. Then our next 2 meetings will review common experiences individuals are facing during the COVID-19 pandemic. So namely, during the second week, we'll be reviewing anxiety and depression. And during the third week, we'll be reviewing grief and bereavement. Our last 2 meetings will shift focus to ways to navigate these difficult times and supporting ourselves and others. So during week 4, we'll review coping skills and self-care tips. And then during week 5, we'll explore creative ways to stay connected with families and friends during the pandemic and quarantine. Okay. So first, it can be helpful to understand the phases of a disaster because disasters like the COVID-19 pandemic have a long-lasting impact. And depending on the stage of the disaster we're at, we may be experiencing different reactions. So these are typical phases of a disaster, including natural disasters. With the ongoing nature of the COVID-19 pandemic, we are not following these phases as directly, but reviewing them may allow us to contextualize some of our experiences. So during the pre-disaster and warning phase, This was likely occurring in the winter time last year. Oftentimes there is a lack of warning that can create fear, loss, and loss of the sense of control. Then comes the impact phase, and this is when the event occurs. So in New Jersey, this was around March last year. In other countries and in other states, this may be occurring at other points of time. And it's also helpful to keep in mind that between the fact that we have had second waves and third waves of COVID-19, impact phase might not be clearly just limited to one date. So during the impact phase, we may have disbelief. And just thinking back to last year, many individuals struggle to understand the significant impact this would have on our way of life. Even that initially many believed that a shutdown would occur for a couple of weeks, and instead the impact of the pandemic continues to significantly impact us today. So next there's the heroic response phase. So this is when the community takes action in the neighborhood. This period may be characterized by high activity with low productivity at times. And it characterizes responding to a disaster and jumping in to help. So we've definitely seen a call to action in our communities as many individuals have dedicated their time and resources to helping others access food, resources, medical care. Next, there's the honeymoon phase. So this is characterized by community bonding, a sense of hope that everything will return to normal, and survivors recognizing the efforts of responders. So although the disaster is not yet behind us, we may have seen aspects of this when celebrating our frontline workers with posters and signs, and even with the large drive-by parades and cheers as we saw in New York. Next, there comes the disillusionment phase. So during this time, hope can turn to frustration, and there's a lot of times stress and fatigue starting to show. So the community may need more substance use services during this time, and the support that's requested by the community typically is related to themes of loss and not having enough been done, not enough help on the way, sometimes a lack of access to what is needed. So again, the pandemic is not yet behind us, but aspects of this have already been applied. So next comes the anniversary of the disaster, and this is characterized by a period of grief. So as a community, we have come to the 1 year of the onset of quarantining. But anniversary reactions also come up within the context of individual traumas and loss of loved ones. So there may be difficult reminders we are processing at this time and at other periods during the past year and upcoming time. Next comes the reconstruction and recovery phase. So this is when people return, rebuild their lives, and vaccines and greater understanding the COVID-19 virus is allowing for this. So I want to take a moment to give you all an opportunity to reflect on which phase reactions resonate most with you at this moment. Again, you can reflect on your own or with the person next to you, and please feel free to return to this during the question and answer portion. Again, I just really want to emphasize that we're not going through a linear approach to the phases of the disaster at the current time. And so you may notice that different aspects of the experience resonate with you. So what makes us feel vulnerable during this pandemic? Our way of life has really been drastically shifted recently, and various factors are contributing to a sense of feeling unsafe and struggling to rely on stability in our lives.
Hello.
Hello?
This is Miss John.
Okay. Okay. So, with the staggering numbers of individuals we've lost these past few months, in addition to the significant shifts in our financial circumstances and our ways of life, we may be experiencing a lot of distress and loneliness. There really is a sense of collective trauma and grief for our communities to process. There is also a community of uncertainty. So although our understanding of the COVID-19 virus and the impacts of the vaccine are being heavily researched, as a community and as individuals, we may still have many questions. We may be uncertain about our own risk and safety. We may feel uncertain about what restrictions our family should abide by, the course of the virus, various financial uncertainties, and so forth. And we may be uncertain as to how long these stressors will continue to impact us. So we may also feel a loss of joy and confusion, a lack of purpose as our routines are drastically shifted. We're also social creatures, so we need interaction, and many of us have been missing seeing our loved ones and holding them. Also, our emotional safety is also strongly impacted by our perception of our physical safety. It's difficult to be happy and relaxed when we're unsure about our health. And the pandemic has significantly disrupted major aspects of our lives. So it's shifted our normal everyday patterns of life with virtual schools and half days, working remotely or only seeing coworkers for part-time, or having to wear masks at work and missing seeing people's smiles. Also, social distancing has impacted family gatherings, holidays, graduations. It's also impacted family relationships. So various members of families may have taken on new roles or lost ones they formerly held for various reasons, ranging from medical concerns to finances to time. Our work relationships and duties have changed, as well as our ability to be involved in the community, attending events, plays, sports events. Also, many cultural routines have been significantly impacted, with marriages, birthdays, graduations put on hold or shrunk down in scale. Also, not being able to present and provide comfort, not being able to be present and provide comfort to our loved ones following a loss, following a birth, has also been incredibly difficult. So I just want to pause for a moment and give you another opportunity to reflect on areas in your life where you've noticed significant shifts. Again, please feel free to reflect on your own or with the person next to you, and to return to this during the question and answer portion. It's also helpful to recognize that we are all reacting differently to current stressors. So this is in part due to our own patterns of responding and ways of coping, our current level of risk, our personal histories, including potential exposure to past traumas, also the norms, support, and ways of making sense of experiences that are provided by our families, our communities, and our cultures also influence our reactions. Here are some common experiences. So people during this time have experienced increased stress, grief and loss reactions, a pervasive sense of uncertainty. For some, a sense of failed moral obligation. Also something that's been called pandemic and COVID fatigue. This time may also be characterized by a desire to give back, an increased sense of gratitude, increased generosity, increased tolerance and patience and resiliency. Here are some common mental health and psychosocial reactions that people are experiencing during the pandemic. So in terms of physiological reactions, this may be characterized by fatigue, sleep disturbances, appetite changes, stomach aches, headaches, muscle aches. In terms of emotional reactions, people have been reporting anxiety, sadness, guilt, loneliness, anger, irritability, hopelessness, helplessness, and apathy. Regarding behavior changes, you might be noticing some changes in your activity level. Some people are reporting crying and arguments. Others are reporting declining job performance and an increase in substance use. In terms of cognitive reactions, people are noticing difficulty concentrating, forgetfulness, difficulty setting priorities and making decisions, as well as nightmares. We can understand self-care or taking care of ourselves or our own well-being as occurring at 3 different levels. So level 1 involves ways to take care of yourself in the moment, right as a stressor arises. An example of this would involve taking deep breaths or telling ourselves some coping statements. This can be useful when we hear some difficult news, when we suddenly feel discouraged or angry or saddened by an experience during our day, when a reminder of restrictions arises, or when we're watching the news, or around the time of difficult anniversaries. Then level 2 involves building and maintaining daily routines to maintain wellness and manage distress, which can focus on eating, sleeping, exercising, keeping in contact with loved ones, and even building in new routines like journaling. Then level 3 looks at long-term investment in wellness and alleviating suffering. This is really looking at what long-term changes you can implement into your life. And it can range from maintaining your physical wellness in a new way, joining a new and potentially virtual group of friends or activities, receiving mental health support services, and contributing to your community. So here is a list of different ways to cope. Some ideas are maintaining a consistent routine when it's possible, taking deep breaths, like I mentioned, stretching, taking breaks from media, whether that's watching it on the news or social media, happy hour Zoom hangouts with coworkers or friends, doing things you enjoy during your time off, game night with family or roommates, or you could even do a virtual game night, listening to music, journaling, exercising, going outside, even if it's just for 15 minutes. Sometimes even just taking a step outside our door or opening our window can be a nice break. Eating healthy, nourishing foods, starting a garden or getting a houseplant, taking a long bath, reaching out to tech support services, which I'll come back to later, and seeking professional help. So I just want to pause one last time and give you the opportunity to review this list and think about if there is one way to cope you'd like to try out. It can be helpful to identify when may be a good time to try it out this week, even thinking about the specific day and time when it would be feasible. And as I mentioned, one way to invest in your wellness is to seek out support. So our program, the New Jersey Hope and Healing Crisis Counseling Program, provides various services, including short-term crisis counseling, emotional support, informational webinars like our meeting today, referrals to additional resources. So if you're interested in connecting with someone individually or learning more about our services, please visit our website. I also wanted to briefly share with you another resource that discusses different referrals you can look into as well. Just going to share my screen for that. Okay. So there's a PDF here called Resources to Support Emotional Wellness, and this will actually be submitted to all of you at the end of our time together. So as I described up here, first it talks about the New Jersey Hope and Healing Program, our program. If you're specifically looking for support services for grief and bereavement, there's 3 really great resources here, both for resources for adults as well as for children. The Rainbows program has some great resources for children. There's also over here a list of different mental health services. The ones on top, this first portion, it provides services for adults as well as for many of them for children as well. Also, some of these do provide substance use services as well, such as Princeton House and High Focus Centers. These 2 on the bottom are specifically services for children and adolescents. Over here, you can also find different helplines that you can contact for free for support. There is even one helpline here that's specifically for youth. And if you're more interested in connecting with someone by text, there's also a helpline specifically for text. If you're interested in additional services, like I mentioned, you're more than welcome to reach out to us. If you're looking for peer support groups, you can also contact this phone number. And if you're looking for mental health services, you can also contact this number. Lastly, if you're looking for group support for substance use, for Alcoholics Anonymous, Narcotics Anonymous, and Families Anonymous, for all 3 of them, you can go to their websites where you'd be able to look online for dates and locations in your areas. They are providing a combination of in-person services and virtual services, depending on what's a better fit for you.